everybody. Hello, Dr. James, biomedical neuroscientist, and also want to serve with you today as an integrative behavioral health coach. One, be able to help you today. We're dealing with COVID-19, and we can see that the President of the United States is pressing to open the country again. So what does that mean for us right now? While the numbers of death in terms of related to COVID-19 are still rising, what does that really mean, and are we really safe? So then it comes a question of how to stay alive during this pandemic situation while they're pressing to open the country. How do we stay alive? What do we do to help us? And so we've gathered some information, and it's all science-based. I want you to understand that. And so what we've done is gather some information because we want to give you an update on what really is going on, and some tips, a little bit of tips of how it is that we can probably start to protect ourselves, because again, they're pressing to reopen the country. Now I have my own thoughts about reopening the country. It's probably easy when the overwhelming numbers of the United States is African Americans that are being hurt or harmed, even death, by COVID-19. We are the largest numbers of people that are affected by COVID-19. So that says a lot. And so being able to take a risk in terms of opening the country, beaches in Florida are beginning to open. I just read something where Texas the governor is about to announce opening the state back up again, and of course you can hear all over the news where things want to go back to begin open immediately. But what do we know as a people, as a community? What do we know? What do we understand? And so there is a lot of people who are beginning to put things together. Like again, we can talk about people, pulmonologists, that have released some information, and then of course it is our job as biomedical neuroscientists to work along with all kinds of doctors, whether primary care, whether they are specialists in whatever area. But along with that, health coaches play a huge role in terms of helping people understand what's going on and what they really need to do according to how the medical doctors have put things. And so we want to work with something here, and there are things that I really want you to understand, so come with me for just a second. I want you to understand some things. There's something called sputum, and I want you to understand what sputum is. It is your mixed saliva with mucus from your lungs, and sputum is made from the secretions from cells lining the respiratory tract, dead cells, foreign matter that is breathed into the lungs, such as tar, and also air pollutants are there, and white blood cells and other immune cells are also there. An infection bacteria also could be present in sputum. The sputum is examined to see if a person has a virus or an infection, as opposed to just having a cold. So that's one of the things, and you see them doing the test. And one of the things that you do want to understand is what's going on with you. There was a doctor, Dr. Jeff Brown, who is a pulmonologist, who dealt with a particular case where a man who happened to have been a surgeon had contracted, and we're going to go worst case scenario first, who had contracted COVID-19, the coronavirus, and he had to be hospitalized. So we're going to go to the worst case scenario, which is a person that's hospitalized, and then we're going to move you up to a person who's just quarantined. That's the best way to handle this. So the local vascular surgeon tested positive for COVID-19, and after 3 days in the hospital, his health was getting worse. The oxygen level in his blood was low, a condition known as hypoxemia, and respiratory failure was a serious concern. After the lungs go, oxygen can't be delivered to the rest of the body. Tissues will die and other organs will follow. It's like a domino effect of one another. So sometimes you can say, well, a person was pretty healthy and they went into the hospital, but tell me exactly what happened. exactly what happened is it's what you will call a cytokine storm that happens, and that's when your first responders to infection kind of come into play, and they go into overdrive. And so when they go into overdrive, they start affecting other parts of your body, like your kidneys and other organs in your body, and they start to destroy them, and they start shutting down. So let's go a little further with this. This doctor, we talked about Dr. Brown, he was a person who studied the immune system and how it reacts to diseases in the lungs. He had studied this, and so the surgeon is in the hospital. He is getting worse. He started out with some flu symptoms, some fevers, some shakes and aches, and some pains, and then he stops working. During the next week, he didn't improve. His fever was unrelenting. His energy depleted. He couldn't eat, and then 11 days later, he returned to the emergency room and was admitted into the hospital. He spent large portions of the day doing breathing exercises, and when the medical staff could not do anything else, they started giving him, of course, the medicine that you hear the president talking about, that's normally given to people who have certain kinds of illnesses that's going on, but that medicine didn't help. It didn't work at all. And so the pulmonologist had to think of something else to do, because he had a patient in there earlier who was a COVID-19 patient. The man was 67, he had been in good health, yet the coronavirus had caused him to suffer cardiac arrest, liver failure, and also shock. He had been given normal treatment for the virus and still raved his body, and earlier that month, that particular man died. That was the case. That particular man died. He had no other health systems problems, but unfortunately, he died because of the storm that went through his body. That's basically what happened to him. And so this doctor researched how the immune system functions in the lungs. He also watched emphysema and asthma, how it affected rats in terms of study. And then there was a growing belief in the medical community that it isn't the coronavirus that itself that kills the patient, but the extreme inflammatory response. And so the immune system floods the cells with proteins that's called cytokines. And so when cytokines are there, when the body produces a rush of cytokines, known as a cytokine storm, blood vessels become weak, allowing fluid to leak in and fill the lung cavities. That can shut down organs and make it very difficult for you to recover. And so the patient's body, which was Jones, compares the body response to a forest fire. It's not too difficult to extinguish a match, but once that match has been dropped into the brush, it begins to burn, and fire spreads. The devastation is more extensive, and the resources needed to stop the fire are more substantial. So here, the doctor thought the treatment of COVID-19 patients are receiving needs to occur earlier in stage, and so he administered medicine to his patient. It's called Actimra. Actimra is what he administered to him, Actimra. And when he did that, which disabled Brown's inflammatory response by blocking specific cytokines called IL-6 or interleukin-6, or what they call IL-6. So there was a different kind of medication applied to him. They applied that medication. The problem with that medication is it is extremely expensive for them to use. Brown was in what you call stage 2 of COVID, about to cross into stage 3 of COVID, which the viral response gives way to a dangerous inflammatory response. The forest fire was about to ignite. So in stage 2, before the patient's inflammatory response went haywire, theories that Jones had developed years ago when he started working on this, which was an intravenous of vitamin C that would also begin to help him, help the patient recover. So this is what stage 1 looks like. Stage 1 of COVID-19 looks like this. It's known in the early phase of the infection. This stage usually lasts about 5 days after contracting the virus. The patient can be asymptomatic or have a somewhat elevated fever and mild symptoms such as aches and pains and cough. In stage 2, known as the pulmonary phase, this stage usually takes place in about 6 through 10 days. The patient can have shortness of breath, hypoxemia, which is a low oxygen to the blood. X-rays and CT scans of the chest can reveal abnormalities in the lung. During this stage, the body typical immune response diminishes and the dangerous inflammatory response increases. The stage is broken into parts of A and B to designate if the body is more in the viral stage or the inflammatory stage. Now, he's in stage 2. It's about to go crazy. He's in stage 2 and things are about to get extremely crazy for him. And so what happens, the understanding happens here, the intersection of the body's immune system and its inflammatory system is a vital link. The health community has been missing something for decades. The drawback on Actemra, which is the medicine that was given, is that it's from about $3,000 to $5,000 per dose. So that's a very high for a patient to get. Now, what he did was he also gave the patient a vitamin C injection, about 4,000 to 5,000 times normal amount of vitamin C in the bloodstream. And so a combination between the new medicine and also the injection of vitamin C brought the patient around. The patient ended up surviving. 45 minutes later, he began to feel better. Things began to change. Within 2 hours, his discomfort had subsided. His fever diminished and his heart rate slowed down. And then a day later, a Saturday, he felt well enough to go home. And a day after that, he did go home. In 3 days, he'd gone from his body almost being overrun by the disease to leaving the hospital after he had gotten the intravenous of vitamin C and also taking the medication. All right, which was much different than what their medication is that they're saying that we should be taking. It's much different. Now, that's the extreme case. We want to go to a case where a person is just quarantined. That's hospital. We're going to go to when it's quarantined. Now remember that your inflammatory response can put out, inflammatory response can overtake your body, and all of a sudden your whole system can start shutting down, and they don't know how to stop it. All right, they stopped it with vitamin C and something called Actemra. Is what they stopped it with, the medication called Actemra, and also with vitamin C intravenous also happened with them. They were able to help this particular patient. Now that's going to be important. Now that's hospital. That turned things around. So you go into the hospital and don't have any health problems, and that inflammatory response system that goes, your first line defenders, what happens is, remember saying, it will go in and try to stop it. If it still detects infection, it will flood it. That's what we call the storm. It'll flood it, trying to stop it. But in the process, it'll damage other organs and tissues will start to be damaged. It'll start shutting down your kidneys, your lungs. You can go into cardiac arrest. All kinds of things can happen when that starts to take place. And that is what's been happening with patients who go in and all of a sudden, a couple of days later, they're gone. That's what happened. All right, now let's go to this guy, Como, who was quarantined at home. He didn't have to go in. He was quarantined at home. A pulmonologist stepped in again and works with him. So he tells him that he can't stay in a rested state, that he's got to get up and he's got to move. He tells him that the fever is going to make his body hurt and makes him feel like he can't move his body. Because it wants him to just, if the COVID-19 or the coronavirus wants to get into his lungs, and so you'll feel it constricting your chest will start constricting, you'll feel like not moving at all. The virus connects with people with underlying illnesses as well. That's the other thing that needs to happen. This particular patient had a low IgM level, which is the primary immune response antibody. and it could be genetic or cultural. It makes you susceptible to things like bronchitis and other infections, so he did have that. But what the pulmonologist told him to do is to get up and told him to stretch his torso, and stretching your torso is like this, stretching your torso. The pulmonologist also told him to take some deep breaths. The pulmonologist told him that it's going to hurt to do it, but he has to do it. He has to get up. He has to move. He's got to be able to do some exercises. And so he gets up, he does some exercises. But along with that, he's got to eat different. He's got to eat differently. He's got to eat lots of fruits. He's got to eat lots of vegetables. And that's how he was able to deal with being quarantined and dealing with the coronavirus or that. Now, we've been doing our homework and walking around trying to figure out how do we help patients at this point, or how do we help our clients at this point that may not have to go be quarantined or may not have to go into the hospital. But everybody is in fear of being able to be affected by it. And if you are, what do you do if you are? What do you do if you are? Not talking about the level of going to the hospital, but if you have to be quarantined at home, what is it that you do? You're going to have to exercise. You have to exercise. You have to change your diet. You have to do the zinc, the vitamin C, the vitamin D. Those will be important to you. You're changing your diet is going to be important. The exercise is going to be important, and also the lung exercises, the pulmonary exercises are going to be very, very important for you to do. You're going to have to learn how to do breathing exercises. There are things that we understand to do, which is a postural drainage, and that is to drain the secretions from the lungs. And so to loosen these secretions, we put you in a particular position, and then we know how to work with you in terms of, or we have what we call a chest vibrator that can be put on you to kind of loosen those secretions up to get it out of you. The idea is to keep your lungs open. So even if you have not had a diagnosis of it, the best thing to do is to do pulmonary exercises. Keep your lungs open. And also just to exercise and eat lots of fruits and vegetables. Drink lots of liquids. Stay hydrated. Drink lots of liquids, especially hot liquids. Keep yourself open, but you also going to have to do lots of exercises. Now, our office is still open. We work with a chiropractor, and people are still coming in, and so we partner with the chiropractor. We do what we call post-physical therapy care in their patients who've already been in physical therapy, or patients who have not been into physical therapy, but they do need exercise therapy. And so we do the whole exercise therapy program with them, but we also do the holistic nutrition program with people as well. So you're going to have to relax and make sure your body's not also stressed out. So we do mind-body scenarios for you to make sure that your body is not stressed. We want to take the stress off of you as well to kind of get you to relax. But this is going to be important, and that is being able to exercise. Breathing exercises and physical exercises is going to be important for you, because what happens is you want to be able to open up your lungs, but you also want exercise to do something else that is very, very powerful and very, very important for you. And that is that you want when you are stressed, the ability of your T cells to multiply in response to infectious agents is remarkably reduced, as the ability to ward it off, and so your cells to recognize and kill cells in your body that have become cancerous or infected with viruses. It's also very important for your immune system to maintain their ability to redeploy so that they can patrol vulnerable areas of your body, the upper respiratory tract, and also the lungs, to prevent viruses and pathogens from gaining a foothold. This process is important to minimize the impact of the virus and to expedite viral resolution that should become also infected. Now, this is going to be very, very important to you, particularly whole body dynamic cardiorespiratory exercise. Instantaneously mobilizes literally billions of immune cells, especially those cell types that are capable of carrying out effective or effector functions, such as the recognition of killing of viruses and infected cells. The mobilized cells firstly enter the blood compartment from the marginated vascular pools, the spleen and the bone marrow before tracking to the secondary lymphoid organs and tissues, particularly to the lungs and the gut, where increased immune defense is also required. So that's exactly what exercise helps, and why we keep talking about exercise. The immune cells that are mobilized with exercise are primed and looking for a fight. Their frequent recirculation between the blood tissues and the functions to increase hosts of immune surveillance, which in theory makes us more resistant to infection and better equipped to deal with any infectious agent that has gained a foothold. Exercise releases of various proteins that can help maintain immunity, particularly muscle-derived cytokines such as the IL-6, the IL-7, and the IL-15. That is very key, and it's very important for you to understand and to know exactly what's going on. So why do we keep talking about exercise? Because exercise will help you in your fight. Your diet is going to help you in your fight. Holistic nutrition, it will help you in your fight. And we talked about vitamin C and vitamin D. All those things, they help you in your fight to stay alive. So how do we stay alive? We went from worst case scenario, when a person's in the hospital and the medication they gave them didn't work, to new medication, and then to flooding their body with an intravenous of vitamin C. We went from there, we talked about breathing exercises, and then went from there, pulmonologists, which is also give you exercises to do in terms of breathing so that you can breathe better. This is going to be after and even before. You should do those things before. And then we talk about exercises that help prepare your body for things, make things better. Opening up, keeping your airways open, your lungs open. Exercise is going to help you do that. Breathing exercises is going to help you do that. So that is key and that is important. You may be interested in a whole lot of things that I've just talked about, things that I've just said. You can call our office. You don't always have to come in because we do have an online platform for you. But that number is 240-33800, 240-33800, and we'll be able to help you out with that. Again, we work within that environment, the medical environment, where we see people all the time coming through with conditions, and not only conditions, underlying conditions. We see people coming in with fear and phobia as well, and so we're trained in both areas to be able to help them. So when it comes down to coaching people through processes, is something that we have an expertise in terms of being able to coach people through illnesses and through processes, whether it's mental or whether it's physical. We have the expertise to be able to coach you through that process. And so I wanted to come online because I want to let you know that no matter what case it is, one, we have faith, but the other is we're going to put some work behind our faith. Faith without works is dead. We're going to put some work behind our faith, and that was important for us to come on and talk to you about, to tell you that it is a possibility of everybody surviving. So there are things that we're really going to have to do. And these studies are actualities. These are not something that we've made up. This is science-based. This is exactly what happened to patients that went in. They weren't sure they were going to come out. It started getting worse. Medication changed. The nutrition part, the supplement changed. The vitamin C intravenous certainly helped. So if that can help, then certainly it can help strengthen our immune system before we're infected. And so we started thinking about things like that. Before we're infected, how do we strengthen our immune system so that anything ever happens, we do have some strength to fight. We do have some strength to fight. If you have any questions, again, call us on the phone at 240-338-4800. If you're interested in any of the exercises that we're talking about, we do have an online platform. Again, you can call that number at 240-383-4800. You're always free to inbox me with any kind of concerns, any kind of questions at the very same time, and we'll be able to give you some help. I'm Dr. John Paul James, and I approve this message.